By the end of this video, you will understand how to progress safely, intelligently, and with purpose after a spinal fusion. Hello friends, Lori Beth here, Doctor of Physical Therapy, and today we're going to talk about what recovery actually looks like after a spinal fusion. Not the generic timeline, but a strategy to help you reach your optimal long-term goals. A successful fusion recovery isn't about one magic exercise. It's about progressive and intelligent intervention, knowing what to do, when to do it, and why. This is about building a spine that trusts you again. Let's get into it. Phase 1 is the early and more acute recovery. Phase 2 is past the acute phase, rebuilding strength and control. And phase 3 is the fun part, as most would assume, the near return to full function in sport. Today we're going to cover phase 1, and this is where everything is set up. And this is the acute stages of healing. If you consider yourself to be fairly fragile, when you're honest with yourself and not just forcing your body to move in ways that it really doesn't feel comfortable, if you feel like you fall into this category, don't skip stage 1. If something doesn't feel right or contradicts what your surgeon or direct therapist has guided you, listen to them first. The goal of early spinal fusion rehab is not to make your back stronger yet. The goal is to restore safe movement, confidence, and to build strength around the spine. We're working on control, breathing, and tension, preventing compensations that can cause problems and often do cause problems later. Think of this phase as like laying concrete. Spinal fusion doesn't end your story. It changes how you write the next chapter. So move with intention, respect the process, and build yourself back better.
Diaphragmatic breathing. To perform diaphragmatic breathing, find a comfortable spot. Place one hand on your chest and one on your belly. Then inhale slowly through your nose, feeling your belly expand outward, not your chest. At least the belly should be expanding far more than your chest does. Then exhale slowly through pursed lips, feeling your belly fall inward. Repeat for several minutes if desired, in order to calm your body and strengthen your diaphragm. Lie on your back with your knees bent and a pillow under your head for optimal comfort. Or you can also perform this seated in a chair with your back supported. If new to the movement, it can help to place one hand on your upper chest and the other on your abdomen just below your rib cage. Push your hand out as if filling a balloon. Your chest hand should stay still. It is optional to briefly hold your breath for a couple of seconds. It helps to exhale slowly. Breathe out slowly and steadily through pursed lips, like blowing out a candle. You can do this for 4 to 6 seconds, feeling your belly gently fall inward. Continue for up to 5 to 10 minutes, and you can practice this exercise several times a day. For success, focus on your belly. The key is to move your abdomen, not your chest, to engage your diaphragm. Pursed lip breathing helps control the exhale and prevents you from taking in too much air too quickly. It can help to start by practicing by lying down and progress to sitting and standing as you get better. Listen to your body. If you feel dizzy, you may be taking in too much air. Slow down and breathe gently. Lie on your stomach, preferably on a mat or any comfortable surface. Rest your forehead on your stacked hands or forearms to keep your neck in a neutral and yet relaxed position. Your legs can be extended and relaxed, a bit wider than shoulder-width apart if this helps your comfort. Aim to relax and allow your body to sink into the floor or the ground. Consciously relax your shoulders, neck, jaw, torso, abdomen, and glutes. Aim to be as still as possible, like a crocodile basking in the sun. Inhale the breath slow and smooth through your nose, aiming to breathe in for about 3 to 4 seconds. Focus on sending air into your belly and lower ribs. Your abdomen and torso should press into the floor. The hand that is resting on your forehead might feel a gentle rise through your back and sides. The upper chest and shoulders should remain still. Exhale slow and smooth through your nose or your mouth. It can be recommended to use pursed lips as if blowing out a candle for 4 to 6 seconds or even longer. Feel your body melt into the ground as you release the air from your Torso. Start by repeating the cycle for 10 to 15 breaths. You can continue up to 5 to 10 minutes as long as you're comfortable and benefiting from the exercise, as long as you're not having any increased pain anywhere else. Practice makes perfect. You can feel free to practice this once or twice a day to help retrain your breathing patterns effectively. Avoid this movement if you are unable to lay on your belly, also known as the prone position. To perform supine pelvic tilts, lie on your back with your knees bent for comfort. Your feet might be flat on the ground or the mat, bed, however your position. Aim to tighten your pelvis and glutes and press your lower back into the floor. This is a posterior pelvic tilt. Hold this position briefly if it's comfortable, and then slowly and gradually release to the starting position, rocking your pelvis forward slightly back into an anterior tilt. Repeat gently rocking your pelvis back and forth, strengthening the core and optimally easing some low back pain. This is a great beginner-friendly core and back exercise. Despite the fact that it may seem simple, this is a movement we often lose as we age. Transverse abdominis activation, or TA activation, usually means engaging your TA or transverse abdominis muscle, your deep core. You do this by gently pulling your belly button towards your spine, feeling a subtle tightening under your fingers inside the hip bones without pushing out, as if you are zipping up very tight jeans. At the same time, you want to maintain normal breathing patterns in order to build core stability for exercises. It can help to position yourself lying on your back with your knees bent and your feet flat on the floor. This is sometimes known as crook lying position. Another helpful technique is to place fingers on your hip bones at the ASIS, or the bony part on the front of your hips. Move your fingers 1 to 2 inches inward and down towards your belly button. Breathe out gently and slowly. It can even help to make a snake-like hissing sound. Feel for a gentle, deep tension or a slight firmness under your fingers, not a bulging or pushing out. Hold this contraction, ideally for 3 to 5 seconds, breathing normally and not holding your breath. If you're new to this, try to get up to 10 repetitions. It can help to do this 3 to 4 times a day. Focus always on quality over quantity. To perform ankle pumps, sit or lie down with your legs extended. Alternately, pull your toes towards your nose and point them back down and away. You can perform this exercise for 2 to 3 minutes, repeating several times an hour in order to boost the circulation in your legs and to prevent swelling or clots. This is especially useful after surgery or when you're dealing with inactivity. This simple movement uses your calf muscles to help pump blood and improve circulation, returning blood back to the heart and maintaining smooth movement throughout your body. Smoothly switch between pulling your toes up towards your nose and pushing them down, like accelerating in a car, moving through a full range of motion when possible. Continue this pumping movement for 2 to 3 minutes, aiming to do the exercises even several times an hour, especially if you're sitting or lying down for prolonged periods of time. This exercise is done often lying on your back or sitting with your legs somewhat straight. You can have one knee bent even. Slowly slide one heel towards your buttocks by bending the knee as far as comfortable. Keep the foot on the floor and slide back out. Focus on having smooth movement patterns, not lifting the heel. Aim to continue to breathe nice and slow through the movement. You can do this exercise 8 to 12 repetitions and up to 2 to 3 times daily. In order to keep the movement smooth, it might even help to have a frictionless surface between your foot and the mat that you're working on. To perform heel slides lying down, lie on your back or a firm surface, like a bed or a mat, with one leg straight and the other one bent. The foot should be flat on the floor. Slowly bend the straight knee, sliding the heel towards your bum as far as you can. Do so comfortably. Keep your foot flat and don't let your knee just simply roll, especially inward or outward. Pause briefly at the top of the movement before slowly sliding your heel back to the starting position, straightening out your leg. If you're incorporating this as part of your program, aim to do 8 to 12 repetitions on one leg and switch to the other to avoid imbalances and so that you can establish a baseline compared to your normal leg, the one that's less affected. Both legs should be able to complete this movement smooth and with control. Keep your heel in contact with the floor bed, and it definitely helps to wear socks or to use a towel or strap under the heel for easier sliding. Quad sets can be performed just about anywhere. If you're new to this movement, start doing quad sets by lying down with one leg straight and a rolled towel underneath your knee. Tighten your thigh muscles by pressing your knee down into the towel. Straightening your knee out by pushing the knee down towards the bed, mat, floor, wherever you're performing the exercise. Depending on the height of the towel, your heel will lift and your kneecap will be pulled upward. If you're new to the movement, aim to hold for 3 seconds. As you advance, you can hold for 10 seconds. Repeating this movement 8 to 12 times for each leg in order to strengthen the quads. Focus on squeezing the quad muscle and not the other muscles like your glutes or hamstrings. As you advance, you'll no longer need a towel roll. You can simply activate your quads by pushing your knee down towards the floor, mat, or bed, wherever you're performing the exercise. To perform glute sets, lie on your back or semi-sitting with your knees bent or your legs straight. Squeeze your glutes or your buttocks together as tightly as possible. Try to hold for 3 to 6 seconds. If you're new, hold for less time. As you advance, you should be able to hold the contraction for longer periods of time. Work towards 6-second holds. You should still be able to breathe normally, and then relax your hips. This simple exercise can be done sitting, standing, or lying down, and it can help waken up your glutes, an important muscle for many functional activities. Seated posture resets. To perform a seated posture reset, start by finding a neutral pelvis. Tuck your chin back and gently squeeze your shoulder blades together while lifting your chest. Aim to hold briefly in order to realign the head and shoulders over your spine. Then release your breath. Repeat these small adjustments to counter slouching posture. Correcting bad posture takes time and consistency. If you are seated, your feet should be flat on the floor and your knees bent at roughly 90 degrees. Gently rock your pelvis forward and back via pelvic tilts in order to find a neutral spot where your low back has a slight natural curve, not arched or flat. Engage the lower body. Your lower abs should be slightly engaged to maintain a neutral spine. Draw your shoulder blades down and back as if trying to tuck them into your back pockets. Gently tuck your chin in, sliding your head back so that your ears align of your shoulders. Keeping your nose pointed forward. This should be a comfortable and not a strenuous maneuver. The goal is to relax the overworked muscles of the neck. It can help to take some deep breaths. As you advance, aim to hold for 10 to 30 seconds and repeat. This is a great micro break exercise. Resetting your posture periodically throughout the day or intentionally for a few moments at a time. Chin tucks can be performed in supine, sitting, or even standing. If you're new to the movement, I typically recommend performing them lying down on your back. This will help by allowing gravity to assist with the movement. Look straight ahead and gently guide your chin straight back as if making a double chin, keeping your head level, not tilting up or down. You should feel a very slight and gentle, comfortable stretch at the base of your skull. Start by holding just 3 seconds and advance to 5 seconds. Release. This will strengthen your deep neck muscles and relax the over-dominating superficial ones, which can help improve your posture and, more importantly, relieve tension and strain in the neck. To perform scapular retractions, retract your scapulas or your shoulder blades by gently squeezing them together towards your spine without elevating your shoulders or shrugging your shoulders up towards your ears. This is a movement that's often practiced in exercises like scapular squeezes or Y raises, and it can help improve your posture and improve the strength of your deep back muscles. Let's break scapular retraction down. You can perform this in any position you fancy. If you're stand tall with your feet hip width apart and your arms relaxed by your sides, gently squeeze your shoulder blades together as if you're trying to hold a pencil between your shoulder blades. Keep your neck relaxed, avoid shrugging, and aim to hold for 3 to 5 seconds before releasing and repeating the movement. As you advance, you can perform this with resistance bands or even a light weight. If you decide to perform this movement facing down, it may be easier to add weight as you perform Y raises. The movement remains the same, but imagine squeezing a pencil between your shoulder blades in order to activate your deep shoulder stabilizers. The movement should come from your shoulder blades and not your neck or back. Keep the shoulders down and away from your ears and maintain normal breathing patterns, exhaling as you squeeze and inhaling as you relax. To perform a seated march, sit tall in a sturdy chair with your feet flat, then alternating lifting one knee towards your chest at a time. Your hip and knee should come up. Pause at the top before lowering back down, keeping your back straight or neutral and your core engaged. Avoid leaning in any direction, especially forward. This strengthens the hip flexors and your core muscles. There are multiple variations like adding resistance bands or ankle weights. You can add reciprocal arm movements for more of a challenge. To perform a log roll in order to protect your back while moving in and out of bed, keep your spine straight as a single unit, not moving torsionally through your spine and back. Move your shoulders, hips, and legs together like a log, getting in and out of bed. This helps avoiding twisting by engaging your abs and using your arms for support, which protects your back during this movement. You can start by sitting at the edge of the bed, pivoting down onto your side as your legs come up onto the bed, then rolling onto your back again as one unit, keeping everything aligned and tight. To get up, you reverse the process, rolling onto your side and using your arms and legs to push back into the seated position. This is a very important technique that is often used after a spinal surgery, but is also useful for people that have chronic back pain to prevent increasing the damage, wear, and tear on your spine. When performing a cat-cow, start on your hands and knees or in quadruped, also known as tabletop position. Your hands should be under your shoulders and your knees under your hips. Inhale as you drop your belly. Arch your back and look up for cow pose. Then exhale and round your spine towards the ceiling. Tuck your chin under and pull your belly in for cat pose.
If you're in rehab now, hear this. Don't rush to prove that you're healed. Build until your body can't be broken by the same thing again. If you want long-term success, you don't skip steps. You own them. Trust the process. Your future self will thank you. And if you want more physical therapy content, health and wellness material, subscribe, and I hope to see you very soon.